Okay, so this is a pressure bag tumescence infiltration of tumescence, and the reason I love this technique is it minimizes hand fatigue. Just of note is after I've done this, right before I'm actually going to do the harvesting, I actually will use individual 3cc syringes with a 25 gauge needle to add further tumescence into the area that I'm about to harvest. But I'm going to only show you in this video the technique of using this pressure bag infiltration. We have it maximally inflated, and we're going to, with a 500 milliliter bag, this is the tumescence in there that has the lidocaine bupivacaine mixture mentioned in the chapter. So what we're going to do first, we're going to infiltrate these little areas that the apices is going to tell me where we're going to go in. So I just put a little bit of 1% lidocaine with 1 to 100,000 epinephrine with a 30 gauge needle. This is so he doesn't feel the entry of the tumescence. And the reason I use these apices is so that I remember where I did it. Otherwise, I wouldn't know where it is. And I just go along here into each of these apices to do that. The next thing, I'm going to put this back down, is I use the 20 gauge. And occipital nerves are near here, so I'm going to start there for maximal anesthesia. I go in, I release the tumescence here. You can start to see it fill up. Now what you want to do is very slowly do this. You can start to see it elevate. And I'm just slowly tumescing it. The reason I came up with this technique is I was having a little bit of a ganglion cyst from injecting too many injectable fillers. So I decided to try to figure out a way that I could minimize the strain. And this pressure bag is really awesome because it just infiltrates all the way across. You can see the spinal needle allows me the ability not to go through multiple times. I just slowly elevate this. Now the reason why you only see a single box here is we're doing a facial hair transplant, and we're going to harvest a little bit of submental hair as well. And we're going to show you that tumescence in a separate video. So I've really filled up this box pretty well. I'm going to come over here. Just in case you felt that I shook a little bit, you know, that's a technique I covered in the chapter. Al here is going to help me put it right there. Vibration always helps minimize discomfort. Again, this is the continuation of the occipital nerves. You can see, I don't know if you can see this, but it's starting to tumesce upwards. Always extend from the occipital nerves, and what I'll do sometimes if it's a little lower is I'll go a little bit lower than this as well. Because if you go just to the line, if you harvest near the line, they could still sometimes feel it. So I'll arch a little bit below the line as well to make sure that we get maximal tumescence. I don't know if you can actually see this. Wish you had 3D glasses so you could see the really nice rise. What's interesting is as we go laterally, there's actually the subcutaneous tissues are much looser, so you'll see a much faster rise in the augmentation, the back side. I'm going to go over here and again slowly do this so he doesn't feel much discomfort. As mentioned in the chapter, he is getting a little bit of intravenous pain control as well. I know that most places don't have that. I think that the key with this is you see that I've only entered this far in, so it's a very slow process. I don't just shove it all the way in there so that he doesn't have much discomfort. And I'm just slowly infiltrating this as I go forward. This is like watching paint dry, but I always like real-time videos. I think it's almost like coming to watch me do this. You know, edited videos are great, but the question always people have is, well, how long does it actually take to do it? So if I shoot a 30-second video, you don't appreciate this is, you know, actually what I'm doing to infiltrate the donor area. And the speed that you're seeing me infiltrate this is real speed. You can see the corner. I'm just going always, if you think about it, up and lateral. That's the easiest way to think about this. As I go to each, now see there's a little gap. I can actually see this area up here between the two that I haven't quite got. So I'm coming up here, it's still not raised, still flat. So I'm just coming up to this area as well. I'm going to put the stopcock on here so it doesn't spray out. Actually, there we go. I'm going to pull it out so it doesn't spray everywhere. I'm going to have you come around this way of the video. Okay, so what we're doing is just finishing this area here. Again, we're now lateral on the right side of the head for orientation. I'm going to just adjust the lights a little bit here to help see a little better. I don't know if you can see that wave of elevation that's happening. This is the auriculotemporal nerve coming up this way, so we're really getting the extension of the occipital nerves as well as the FUE of the auriculotemporal. And if I can get this area truly anesthetized well, then he shouldn't feel the secondary nerve that I'm infiltrating as well. So now at this point, I could either go to that point or I can sort of arch like this. See how he does with that? And you're going to see a much more rapid subcutaneous elevation when I do this, and that's normal. So I have really two techniques I described in this chapter of tumescence. You saw that in the other video, which is just subcutaneous injection. The one slight modification since that video, besides this, as I mentioned, is I don't do a lot of 10 milliliter or 10 cc syringe injections anymore, because I find that 3 milliliter injections really have a lot less hand strain. So as I mentioned, as I come back to do the final tumescence, I'll be using 3 milliliter syringes with the same tumescent fluid and a 25 gauge needle. So that's the end of the video. I hope that was clear about how I do tumescence injection using a pressure bag.